A tentative deal with Kaiser Permanente has been reached this morning. And given the current environment, a deal between the opposing sides after only 3 days of walkouts is pretty surprising, but the disruptions were extensive given how many areas of healthcare were impacted. Let's bring in Yahoo Finance's Anjalee Khemlani to give us the details. Anjalee.
That's right. Lucky to hear this deal or tentative agreement now, before another strike in November that was planned by these union workers. So let's take a look at what the tentative deal includes. That includes a pay raise, about $23 for minimum wage for workers in other states, $25 in California. 21% wage increase in the next 4 years, increases in the performance sharing plan, and investments from Kaiser in job training and dealing with those staffing shortages that have been really the crux of the issue, including that cancellation of the November strike, and all of this to go in effect if ratified by those workers. About 80,000 of those by October 18th, and it would be, backdated to October 1st. Now, this has really impacted a large swath of the country. We know Kaiser is one of the largest health systems, and it has affected 4 states in total, about 75,000 workers impacted, and it's caused delays in things like surgeries, chemotherapy. Non-urgent care has been largely impacted in some of the same ways that, if you recall, during the pandemic, there were delays for non-urgent care. So that's something that has been averted by this potential deal, and we'll have to keep an eye on it. As we know, labor shortages are a very big issue today for hospitals and health systems.
And Anjalee, hospital insurer contract negotiations are being widely reported this year. What's going on there?
That's right. To my point just now about Kaiser, great news on the front of, getting this deal in place. But if it were any other hospital system, they would then have to turn around and get that money for these increases from somewhere. And that somewhere is the payers, so the insurers. And so we're seeing that friction of what the hospital needs are around the country to continue to operate, while also looking at what has happened post-pandemic. During the pandemic, hospitals had to, like I mentioned before, really fix and create ways to work around the unprecedented demand on their systems. They got federal dollars in for some of the work they were doing, but with that gone away, they're faced with trying to balance out their balance sheets. Essentially, they need to look at a way to make their hospital run efficiently, economically, and not run out of money and maintain margins. So that's something that they're now fighting with insurers to increase their commercial rates, looking at ways with changes in some of the state laws and federal laws and payment models. A lot of stuff coming down on these health systems and putting pressure on their revenues. And so how this all pans out with all of these negotiations going on is going to be something we'll have to take a look at, definitely by the end of the year, to see how many hospitals end up out of network or how many contracts end up falling through. It's something that could potentially impact some specialties or certain areas of the country more than others. So we'll definitely have to keep an eye on that.
Yes, we will. Thanks so much, Anjalee. Really interesting stuff.